Confirmed cases in our state the past 3 weeks have been at record highs. As a reminder, hospitalizations typically lag overall cases in the market by about 1 to 2 weeks. For this reason, our forecasting models predict that hospitalizations from this most recent Omicron surge will peak around mid-February. Hospital admissions for COVID and suspected COVID have been steadily increasing since the beginning of this month. They now account for more than a third of our total inpatient population. Staffing continues to be a top priority for us as we respond to this current wave of COVID cases and hospitalizations. As I've mentioned in previous press conferences, our team members are also members of the community. So when positivity rates and case counts increase in our communities, our team members are exposed and infected with the virus too. We continue to follow CDC return to work guidance for healthcare workers and utilize travel workers to augment our core staff. We are committed to providing a safe care environment for our patients and team members. Due to limited staff availability, some of our Banner urgent care locations remain temporarily closed. If you need to access urgent care, please check online in advance to make sure your preferred location is open. It is also a good idea to schedule an appointment online if there are slots available. This will help to reduce your wait time. Banner Urgent Care will offer telehealth appointments, and the service is a great option for those who want fast care right from home. You can schedule an urgent care telehealth appointment on the Banner Health website. Vaccination continues to be your best defense to prevent serious illness, hospitalization, and death due to COVID infection. Boosters will help maximize your protection. Currently, 83% of hospitalized COVID patients at Banner are unvaccinated or partially vaccinated, and 87% of ICU COVID patients are unvaccinated or partially vaccinated. Outpatient treatment for those who test positive with COVID is also available, though supply of these treatments remain very limited. These treatments include monoclonal IV antibodies such as sotrovimab and oral antivirals as Paxlovid and Molnupiravir. All 3 drugs have received emergency use authorization by the FDA. Patients must meet criteria to receive a referral or a prescription for these treatments. So it is important that you consult with your primary care physician or an urgent care provider as soon as you start experiencing symptoms. Your provider will determine if you qualify for these treatments. Due to the limited supply, not all who qualify will ultimately be able to receive them. The Arizona Department of Health Services has developed antiviral prioritization tiering based on the supply in our state. Those who are aged 70 or higher and individuals with major immune suppression are top priority. Once you receive a prescription for oral antivirals, you can visit the AZDHS website or contact Poison Control Hotline to find a retail pharmacy to fill it. That number is 844-542-8201. As a reminder, Banner has discontinued the administration of other monoclonal antibody treatments as they have not been effective in treating patients infected with the Omicron variant. I know that most of you have grown tired of masking, but it is still a very important tool to protect yourself and reduce the spread of COVID during these times of very high transmission. Please continue to wear a high-quality fitted mask when you're in indoor public settings or around large crowds. N95 and KN95 masks provide the best protection. Thank you for your time this morning. I'm now happy to answer any questions that you may have.
Thank you, Dr. Bessel. At this time, I will read questions submitted by the reporters in attendance so that Dr. Bessel can answer them. Just a friendly reminder to our media partners, please include your name and media outlet affiliation with your question. So our first question comes from Liliana Salgado from Univision here in Phoenix. When do you expect current surge to slow down? Some experts, including the World Health Organization, say Omicron might be the end game of this pandemic. What's your take on this?
So as I stated in my opening comments, we are still having increased numbers of COVID in our communities, and we do expect that we are close to the peak, probably occurring in early February. Certainly, I know that we are all tired of this pandemic. We've been at this here at Banner Health for 2 years of planning and taking care of our communities. Omicron has really overwhelmed our communities. It's become the predominant strain, became the predominant strain in a very, very short period of time. And we certainly hope that this will end the pandemic part of what we are experiencing and push us into the endemic part. As we've stated previously, this virus is not leaving this earth, and we will need to learn how to live with it, but hopefully it will be at a lesser level of prevalence and perhaps become more of a subdued type of infection, perhaps becoming more secular in that we have it maybe in the winter season with other respiratory pathogens, and we learn to live with it in that fashion. We still don't know for sure if that's going to happen, so I'm going to remind all of us to do what you can right now to stay safe. Please, if you're not vaccinated, get a vaccine. If you're not yet boosted, get a booster. And very importantly right now, while we're having this high transmission in our communities, wear a really good, well-fitted mask. A KN95 or an N95 will add that additional layer of protection for you until our case counts go down.
Katie Davis-Young from KJazz Radio here in Phoenix asks several questions. So I will read the first two to you because they go together. So how many urgent care centers are currently closed, and do you know how long they might be closed?
So as I've stated at our previous press conference and also today, our staff live in the communities with all of you. And while we are having high transmission rate, our staff, despite being vaccinated, are also exposed to that high virus circulating in the communities where they live. Our urgent care closures are a direct result of our staff and the number of staff who are currently unable to come to work. We have, at any single day, a number of our urgent cares are closed. We can get you the actual number for today. But as we have been working throughout that situation, we offer other options for you to still get care. So please, if you need to go to urgent care, check in online and schedule an appointment if you are able. For those urgent cares that are close in your community that might be closed, we do have a tele option, and you can also schedule for that tele option on our Banner website. We do expect that as this peak and as this wave of Omicron ultimately peaks and then subsides, that we will be able to open up more of our urgent cares. But we are also committed to providing a lot of variety of options for you to receive care, and the tele option will remain a good one even post this Omicron surge.
The other question that Katie Davis-Young from KJazz asks, on average, how many staffers have Banner facilities been short in recent weeks?
So thank you. Our staff have been just so committed to taking care of our communities throughout this entire pandemic. Our staff are over 91% vaccinated, which is helping them stay safe and healthy and able to come to work. However, the Omicron surge that we are all experiencing in our community, even for those that are vaccinated and boosted, is still having an impact. Our staff, we do have staff who are ill each and every day who are calling off, but we've also been able to augment our staff through external contracted labor. We have individuals who work in other parts of our organization that are being redeployed to make sure that we have appropriate staff to take care of our hospitals. At this time, our hospitals remain very busy. Our emergency departments are also busy, but we are open. At each individual facility, they're making day-by-day decisions about whether they can proceed with all of their elective surgeries. Again, these are medically necessary, indicated surgeries, and we have had very limited numbers of those that have had to be canceled. So please, if you are having an emergency condition, please come into our emergency department to get care. If you're not having an emergency condition, please obtain care, but do so through urgent care, a tele option, or your primary care physician.
Nicole Grigg from ABC 15 here in Phoenix asks, are you seeing less number of COVID-19 patients needing critical care with Omicron, or are they still in high need of critical care as we have seen with Delta?
So our ICUs remain busy. but we are starting to see that shift of decreased severity of this COVID wave compared to previous COVID surges. So our ICU numbers are less than they were during our peak of January of the prior year. And we believe that is a direct result of the decreased severity that we're experiencing with Omicron. However, the total number of patients that we have that are either COVID positive or COVID suspected is at an extremely high level right now. But many of those patients are requiring a lesser level of care below the intensive care unit levels that we experienced with the Delta wave and prior waves before that one.
Stephanie Innes from the Arizona Republic asks, what is the situation with pediatric COVID-19 hospitalizations? Have they increased during this current Omicron-fueled wave of patients?
Pediatric COVID volume in all of our markets has remained relatively low at this time.
Anito Kelly from TucsonSentinel.com asks, how many cases in Arizona Banner hospitals are cases of the Omicron variant?
So we do not sequence the variants for patients that test positive for COVID in our hospitals. A number of those sequences are done through outside vendors, but as we have followed those statistics from those others who are doing the sequencing, the Omicron variant became the dominant variant here in the state of Arizona late December and has been the absolute predominant variant throughout the month of January. Very high, 90% of all variants at this time are now related to Omicron, and there is almost nothing left of the Delta variant or other variants in the state at this time.
Jasmine Ramirez from KOLD Channel 13 in Tucson asks, has Banner stopped hiring travel nurses? And if so, how does this impact staffing levels?
Banner has committed to a large number of individuals who come to us through the external contracted route to help augment our core staffing throughout the entire pandemic and during this winter season. We continue to have those individuals come to Banner. We have a number of individuals who are starting their engagement with us this week, and we expect that we will need to continue to have a fairly good portion of our staffing provided through that throughout the rest of this winter pathogen season.
Nicole Feltman from Tucson Local Media asks, are there vaccinations and boosters being administered at Banner locations right now for staff, patients, and others in the community? If they are not being administered, what's the reason?
So Banner has been committed to providing vaccination throughout this pandemic, and we still do have avenues for individuals to receive vaccination throughout multiple different locations within Banner. Thank you for that question, and a reminder that the best way to protect yourself against becoming infected, being hospitalized, being in our intensive care unit is to get vaccinated. As I stated in my opening comments, the vast majority of individuals who are hospitalized right now in our hospitals are those that are unvaccinated or only partially vaccinated. So if you're not yet vaccinated, please do so. If you are vaccinated but have not yet received your booster, please do that as well.
Liliana Salgado from Univision here in Phoenix asks, you say 83% of your COVID-19 patients are unvaccinated. This number used to be higher. So are there more breakthrough hospitalizations? Do you believe this is due to people that are not boosted and have lost some protection against Omicron?
Yeah, so let me just restate those statistics. So currently 83% of hospitalized COVID patients at Banner are unvaccinated or partially vaccinated, and 87% of our ICU COVID patients at Banner are unvaccinated or partially vaccinated. Yes, with the Omicron variant, we are seeing a slight increase in the number of individuals requiring hospitalization who are having a breakthrough infection. Our numbers were a little bit higher of who was unvaccinated in the prior wave. However, I would still recount again, that 87% of our patients who have COVID in our ICUs are unvaccinated or partially vaccinated. Vaccine by far and away remains the most effective way to protect yourself against becoming infected and needing hospitalization or ICU level of care.
Andrew Melendez from KVOA Channel 4 in Tucson asks, has there been any thoughts to using student nurses?
Thank you. We have been working very carefully and closely with our universities that are training our nursing students, and we've been working with them to bring them on board very close to the time when they are graduating to augment our core staffing. We expect to continue to do that as the pandemic hopefully comes to an end and we enter into the endemic phase of this as we continue to work to increase our core staffing in future months.
Melanie McEachin from the Hurdle Report asks two questions, so I will ask you the first, Dr. Bessel. Does Banner have any recommendations on places to obtain KN95 or N95 masks?
We do not have any official recommendation on where to obtain a KN95 or an N95 mask. Masks have become much more readily available throughout this part of the pandemic compared to prior parts of the pandemic. And you can go online and there are a number of different suppliers that will be able to provide you with an appropriate mask.
The second question asked, are Banner hospitals currently experiencing shortages of medical materials? For example, syringes, specimen collection tubes, medical vials. If so, does Banner have any insight into expectations for medical supplies and shortages due to supply chain issues going forward?
Throughout the pandemic, Banner Health, like all other healthcare systems throughout our country and throughout the world, have intermittently experienced shortages of different types of supplies. We've been able to utilize our usual process of subject matter experts when we have experienced that to come together and figure out how best to mitigate through that. At any one particular day, it is likely that we are experiencing some type of potential shortage of a supply and have taken steps to make sure that we're able to continue to provide appropriate care. This actually happens in non-pandemic times, and we have become very accustomed to being able to mitigate through those types of shortages. Today at Banner Health, there is not anything that is causing a significant shortage that has required us to make significant changes to our usual process delivery.
Nicole Grigg from ABC 15 here in Phoenix asks, we have heard fears of crisis standards of care in our hospitals. Did Banner come close to this, or were you able to, quote unquote, dodge a bullet?
So today, Banner is operating under crisis staffing, which is what we have spoken about previously, that allows an expedited process for individuals who have COVID to come back to work under a certain safe set of scenario. That includes things like making sure that everybody is masking appropriately, as an example. As far as crisis standards of care, Banner Health has not had to implement that related to direct patient care. I do believe that the Omicron variant has provided an opportunity for the Delta surge in the state of Arizona to not reach its peak that it might otherwise have done had Omicron not come in and overtaken the Delta variant. We are very thankful for the fact that, as I've shared earlier, that our intensive care unit population is actually at a lesser level than it was in prior surges. But we want to ask everybody to remain vigilant at this time. We have not yet peaked with this Omicron wave, and we still have some time ahead of us. Please get vaccinated, get boosted, and wear a good KN95 or N95 mask until we peak and get over that peak and are headed down when we can go back to a more normal type of scenario of transmission in our communities that does not require this level of vigilance. But we are not there yet. So please help and do your part.
Another question asked by Nicole Grigg at ABC 15. We have heard doctors running out of sotrovimab. Are Banner facilities out of this drug as well?
So sotrovimab is the monoclonal antibody that is effective against Omicron. It is in scarce supply at this time. Banner does have multiple locations where you can receive monoclonal antibody, but because of the scarcity of the supply of this particular drug, there is a tiering of criteria that you must meet in order to get monoclonal antibody of that type. If you are experiencing symptoms that could be COVID, please get tested. If you test positive, please get with your primary care physician or go to urgent care to be assessed as to whether you meet those criteria. And if so, then we will evaluate you and see if we can find an appointment that has sotrovimab available for you. Most importantly, if you're in a high-risk category, get tested early and talk with your physician about whether you meet criteria.
And that is the last questions. Thank you, Dr. Bessel. So we have reached the end of our press conference. Thank you all for joining us this morning. As a reminder, a high-resolution video transcript and any materials shared with you during this press conference will be available at bannerhealth.com/newsroom. Please allow 2 hours for us to post all these materials. Please send any follow-up questions that you have to media@bannerhealth.com. Thank you.